Hello, I'm Dr. Arjun Handa, plastic surgeon and body contouring expert at Handa Aesthetics and Plastics. So tummy tuck is a procedure where we remove the excess fat by liposuction, remove the skin on your tummy and also tighten up the muscles. So before you go for this procedure, it is very important for each and every patient to understand what the post-operative period is going to be like and when are you going to be able to see the results. So in the post-operative period, you will be required to stay in the hospital for at least 1 day. This is important to ensure smooth recovery after the procedure and to ensure that it is absolutely safe before you go back home. Second, there will be some drains placed which are plastic tubes under your skin flaps coming out of your belly. They will be coming out from below the scar line of the tummy tuck. It is very essential to place these drains because they prevent any accumulation of fluid beneath the skin flaps. Although some plastic surgeons will avoid the use of these drains, but we feel that it is better to be safe rather than sorry and to prevent the occurrence of a complication rather than to manage it later on when it does happen. Third, you will be able to return to your daily activities from the second or third day at home. There is no bed rest. You will be ambulated the next day, that is, you will be walking around in your house carrying out your daily activities. So there is no limitation of routine activity after a tummy tuck. Now in the post-operative period, there are two things which are absolutely mandatory, and if the patient is deciding to be non-compliant, now there are two requirements that are absolutely mandatory for each and every patient deciding to undergo a tummy tuck. And if the patient says that for some reason they will not be able to carry out these, then we cancel the procedure and we tell the patient to be ready for them before they go for that. These two mandatory requirements include: 1. Compression garment. A compression garment is a tight garment which is to be worn for 24 hours a day for at least 6 weeks after the procedure. It has to be worn 24 hours a day even while you're sleeping, and it can only be taken off while you're taking a bath. This garment actually prevents the swelling from increasing too much. It ensures smooth recovery and smooth healing process in the post-operative period. Without this garment, there is a high chance that lumps and bumps may form, bad scarring may occur, and fluid may get accumulated below the skin. The second most essential requirement are lymphatic massages. These massages are done by a trained physiotherapist. They are mild, superficial massages, unlike the spa massages which massage your muscles. Also, the physiotherapist will decide to use a pneumatic compression device or an ultrasound device to break up or decrease the swelling and scarring occurring beneath your skin. These massages are usually done in sessions of 10 consecutively on 10 days, starting from the post-operative day 4 and ending on the post-op day 14. The physiotherapist may advise you to undergo more massages based upon their discretion and also on their analysis and evaluation of your healing process. But it is absolutely mandatory to get these two things done in the post-operative period. Apart from that, you will be able to return to work on the 7th or 8th day. Also, you will be able to return to exercise and lifting weights from the 6th to 8th post-operative week. The swelling takes about 6 to 8 weeks to go after a tummy tuck, and the results become apparent at that time. So these are some things that you should absolutely know before undergoing a tummy tuck procedure and absolutely understand them, because understanding these points will make sure that your post-operative recovery is going to be smooth, it is going to be uneventful, and you will have an awesome result at the end of 6 to 8 weeks. Thank you.